Hi everyone, Whitney Lowe here, and welcome to another one of our Clinical Insights videos where today we're going to be talking about pain in the neck. Yep, that's right. Everybody has clients that come to them having neck pain, and especially pain right at the base of the head. And this is something where there's oftentimes problems in the suboccipital region, or with the suboccipital muscles in particular. This is a very small group of muscles, but so important in controlling movements of the head and also playing a role in many of the pain complaints that people have with headaches, neck pain, myofascial trigger points, and all kinds of other things that cause discomfort in this area. So today we're going to take a deep dive look at some of the anatomical structures in there, some important characteristics, and most importantly, some really crucial precautions for you to take note of when you're treating people in this area. So let's go take a look. One of the first things I want to focus on here is how many different layers of muscles there are in this area. As we can see here, we'll start with what are the most common places for people to report discomfort, mainly in the larger upper trapezius muscles. And then as we sort of go through the layers, we have down below that the splenius capitis muscle right here. Let's highlight that one. Then also semispinalis right underneath it just here. So in the posterior neck region, we've got those different layers that are sort of wrapping around each other and doing different things. Let's take a couple more of those off and see what we're having here. Now, once we get those off, we can look at the suboccipital muscle group, and this is a group of 4 small muscles on each side. Let's zoom in a little closer to take a look at those. So here you can see the 4 muscles on each side. This is rectus capitis posterior minor, rectus capitis posterior major, obliquus capitis inferior, and obliquus capitis superior. So you can see these muscles are spanning between usually the C1 and C2 cervical vertebra up to the occiput, or just between C1 and C2 by themselves. Now, there's some important considerations about the anatomical structure of these. In particular, there is a small connective tissue slip that goes from the rectus capitis posterior minor over to the dura mater inside the spinal canal. This is sometimes called the myodural bridge. Let's take this off for just a second so we can see deep inside there. So here we've taken those suboccipital muscles away, and we're looking at the superficial nerves that are in this area, but here's the dura mater inside here, which that myodural bridge connects between the rectus capitis posterior minor and that dura mater. Now, as we know, the dura mater is a membrane that covers the brain and spinal cord, so it runs all the way from the entire covering of the cranium all the way down through the whole length of the spinal cord, and it is highly and richly innervated. So, of course, there's a lot of sensitivity in the dura mater, so some adverse tension in these muscles could be transmitted to the dura mater and make some difficulty in its full mobility, and could lead to headache, pain complaints, and a number of other complaints that people might be experiencing. Now, also, we don't think about this very much, but there's some other superficial nerves in this area. So we have some of these suboccipital nerves. So the greater occipital nerve here, and also another one right next to it on each side. Let me zoom back out for just a second. We can see these nerves are also sitting here. And let's put our muscles back on for just a second so we can see the relationship of those. Here's our suboccipital muscle group with those nerves lying right over them. Now, of course, if we put the other additional muscle layers on, we can see that some of them are now covering these nerves, which are, again, motor nerves to the semispinalis, multifidus, and some of the other muscles that are around this area. So when we work on somebody's neck in this area, we're pressing directly over some of these nerves, and sometimes nerve entrapment problems in these nerves can lead to headache pain, neck pain, or some of the other complaints that your clients might be experiencing. Now, another critical factor in this area that we need to focus on is the relationship of these muscles to the vertebral artery in particular, and also as it blends together and becomes the basilar artery. Let's look at that a little bit more closely here. We can see the vertebral artery, and let's isolate it just by itself for just a second here. If we notice the vertebral artery, this is really interesting anatomically because it comes through each of the transverse processes in the cervical region through this small foramen or hole right here. It comes up through the transverse process, and then as it comes across the cervical region, and let's back down here just a little bit, it takes a very sharp right angle turn right across the top of the atlas here, and then blends up into the cranium. Now, once it goes into the cranium, let's go back for just a second. We can see where it goes and what it's connecting to. And we'll take the occiput off here for just a second. Now we see that vertebral artery coming up here, making that right angle turn, going on up into the cranium. And let's add just another layer of arterial structures in here. You can see they blend together into what's called the basilar artery, which is a major blood supply to the brain. Now, why this is all relevant is because a lot of times when we're putting pressure in this area, we may inadvertently press on that vertebral artery and cause an impairment to blood flow going into the brain. So many times you may have been trying to work these suboccipital muscles, and a lot of people learn how to do this with their client in a supine position and maybe their fingertips placed on each side of the occiput, pressing up into this area, trying to work those suboccipital muscles. Now, if we take those off again for a second, we can see how close that vertebral artery is right here to the area that we're working. And if sometimes it depends on just an anatomical anomaly with each individual, but you can, in fact, put pressure on those vertebral arteries and impair blood flow to the brain. And your client might experience dizziness, vertigo, ringing in their ears, or seeing stars, or some other kind of neurological disorientation. If they ever express those kind of symptoms, you need to immediately stop your pressure and stop doing that particular technique, because you could be impairing blood flow to the brain. The same thing can happen if you're doing any techniques where you're pulling the head into full extension or hyperextension, where the occiput is really tipped all the way back like that, all the way tipped back, and you're holding their head in that position. There's a lot of times we'll maybe try to work the anterior scalene muscles or the anterior cervical muscles by tipping the head back in that position. That can put a person in a vulnerable position for compression of those vertebral arteries. So watch for any of those signs or symptoms that could be indicative of adverse pressure on those structures in that area. This is one of the areas that's gotten a lot of concern, especially in some of the other fields which do high velocity manipulations, because rapid forceful rotational movements, especially if the cervical region or the head is in a little bit of extension, can put adverse pressure on this area and cause damage or sometimes complete dissection of the vertebral artery, and that can be extremely dangerous and in some cases fatal for individuals. So this is a caution to watch out for in terms of adverse pressure being put on those arteries. So the big question we're going to want to focus on is, what can we do in this area that will be safe and yet still be effective for working those muscles? Because these muscles are so short and small, it's very difficult to come in with a broad contact surface like the palm of your hand or the fingers, the flat surface of your fingers, to really get down into those muscles to put adequate pressure on them to help relieve tightness and hypertonicity in those muscles. They really benefit from a small contact surface of pressure, like the individual fingertip or your thumb, or sometimes a pressure tool or something small like that. But we got to be careful about how we do that so we don't put adverse pressure on those arterial structures. One way you can do this is just working one side at a time instead of trying to do both sides simultaneously. So instead of cradling the client's head in both your hands, maybe just do one side at a time. And that way, if there is any arterial impairment, there's still blood flowing through the opposite side to supply blood into that basilar artery in the brain. Now, there's a couple different effective ways that you can address those suboccipital muscles. Again, this is often done just in a seated position with the fingertips at the base of the head, but you can also sometimes come around the side of the table and use your fingertips or thumb to press up into those muscles and just turn the client's head slightly to the side, and that'll give you much easier access to working those areas. We'll eventually put some videos together showing these techniques and showing some different variations on ways to do this more effectively. So just as a recap, these suboccipital muscles are very important for addressing numerous types of pain complaints, especially headache pain or discomfort that people feel in this area. And it's very effective to work them, but you need to be careful and cautious about how you apply pressure in this area so you don't cause any adverse results. So if you enjoyed the content in this video, be sure to visit our website at academyofclinicalmassage.com. There you can download our assessment cheat sheet and learn a lot more about how to identify various types of soft tissue pain and injury problems. You can also learn more about some of the different courses and other educational options that we have available for you. We want to help you become the best clinician you can for treating pain and injury conditions. That's our mission. Be sure to like the video and subscribe to our channel so you can keep up to date on a variety of different clinical topics that we cover, helping you to become a much better clinician. Feel free to leave us a comment below and let us know if you found this video helpful and any other topics you'd like us to cover as well. We'll see you in the next video.